Short note on optic neuritis. It is an inflammatory and demyelinating disease of the optic nerve. Coming to the etiology, there are 7 different causes for optic neuritis. It can be idiopathic, that is not associated with any underlying conditions. Hereditary, where Leber's disease can be a cause. Demyelinating, where most important cause is multiple sclerosis. It can be para-infectious, which can be associated with some viral infections like mumps, measles, etc. And it can be infectious optic neuritis, where some infections are associated with it, like acute ethmoiditis, which is sinus related, or it can be due to infections like TB, syphilis, Lyme's disease, etc. Autoimmune, it can be associated with SLE, polyarthritis nodosa, and other autoimmune conditions like sarcoidosis. And another group is toxic optic neuritis. Now coming to the classification of optic neuritis, it is mainly classified anatomically into 3: papillitis, where only the optic disc is involved; neuroretinitis, where both the optic disc and the retina, which is surrounding in the macular region, is involved; retrobulbar neuritis, where the optic nerve, which is behind the eyeball, is involved. Now it can also be typical and atypical, and typical is characterized by the presence of demyelination, and atypical there is no demyelination. And typical example is multiple sclerosis. Now the clinical features can be learned with a mnemonic: cup, twice, march; C for central scotoma; color blindness; unilateral loss of vision; Uftoff sign, that is the vision loss increases on exposure to heat and also on exertion, and reduces vice versa. And Pulfrich phenomenon is the absence of depth perception, especially on moving objects. Then there can also be pain on ocular movement. So the code is cup, twice, and march. MAR is for Marcus gun pupil. So RAPD is seen, which is a sign. And ophthalmological features include, in the case of papillitis, there can be hyperemia of the optic disc and surrounded by blurring of margins. And in neuroretinitis, you can see a macular star formation. Okay, now visual field defects, there can be central scotoma, and in FFA, that is fundus fluorescent angiography, you can see a leak which increases with time. So treatment, first you have to identify the primary cause and treat it, or the second is corticosteroid therapy, and the third is interferon therapy. Corticosteroid is based on ONGT recommendations. So based on the ONGT recommendations, IV methylprednisolone is started at the dose of 1 gram daily for 3 days, and that is followed by oral prednisolone 1 milligram per kilogram per day for 11 days. So total duration is 14 days, and after that you have to taper the dose of steroids over 4 days.